Today, the CDC and FDA announced a pause on the administration of one of the 3 vaccines approved by the FDA for emergency use in this country to prevent COVID-19. Now, the Pfizer and Moderna 2-shot vaccines are not affected by this announcement at all. But administration of the 1-shot Johnson & Johnson vaccine is being stopped on a dime because of 6 cases of blood clots among women who had recently been vaccinated with the Johnson & Johnson vaccine. Here to answer, hopefully, the approximately 1 gazillion very detailed questions I have about this is our nation's Surgeon General, Dr. Vivek Murthy. Dr. Murthy, it is a real honor to have you here with us tonight. Thank you so much for taking the time on, I know, what has been a really intense day.
Well, thank you so much, Rachel. It's good to be here with you, and I'm looking forward to your 1 gazillion questions, as you said.
Good. Well, let's jump right in. This is 6 adverse events, 6 incidents in the United States after nearly 7 million doses of this vaccine were administered. When it is such a rare occurrence like that, literally less than 1 in a million doses being correlated with this adverse occurrence, how do the FDA and the CDC, how does the administration decide that something that's that rare is nevertheless worth alerting the country, taking this dramatic step of stopping the administration of this vaccine?
Well, Rachel, it is such an important question. And what it gets at the heart of, what it really gets to the heart of is what's important and what's a priority right now, and that's safety. As you mentioned, these are 6 incidents out of 6.8 million people who have received the Johnson & Johnson vaccine. But what was concerning about them, Rachel, is that these were serious side effects. These were rare but serious blood clots that developed. And in one case, somebody died. And so the CDC made the difficult but important decision with the FDA to take time to investigate it and to push pause on giving further vaccine until we could determine whether there was in fact a connection between the vaccine and these dangerous blood clots. I should just mention, Rachel, this also. Pausing is not uncommon. When new drugs come out, new vaccines come out, it is actually not unusual to pause when you see a signal, to investigate it, and then to unpause and go back to what you were doing before, or to resume but with modifications, or in some extreme cases, to stop altogether. But this is a reflection of how deeply we are prioritizing safety, recognizing that if we want people to take this vaccine, they've got to know it's effective and it's safe.
Blood clots are a thing that happens. They're not the most rare medical complications in the world in the normal course of things. But am I right in understanding that in this instance, part of what was alarming, part of what was dangerous, and that was truly unusual, is that what was seen here in these 6 instances was a combination of these patients having blood clots and also low platelets. And that's a strange combination that you don't usually find. So it's both unusual and also had implications for how you would treat blood clots presenting in this kind of circumstance. The kind of treatment that you would usually issue, a blood thinner that you would usually give somebody who's facing a blood clot, is something that actually shouldn't be administered in this case. Is that right?
You're exactly right, Rachel. Clots are not rare events. They happen, and they happen with a significant frequency. What was unusual about this was that these blood clots were happening at the same time as another finding, which were low platelet counts. And platelets are the cells that help your body in the clotting process. The fact that you had clotting happening at the same time as low platelets was a warning sign. And we do see that in rare circumstances and some rare conditions, but those conditions have to be treated with the utmost of care. They often involve getting hematology specialists involved. And very importantly, they are not treated with the typical blood thinners like heparin that you might give a patient who comes in with a routine clot. Which brings up why this pause was instituted, Rachel. It was not only to investigate a potential connection, but also to give us time to speak to and engage the medical community to help them understand what we were seeing so that they could keep an eye out for similar symptoms that may indicate to us that this was happening in other patients.
So if somebody watching this right now has had the Johnson & Johnson vaccine, a woman between the ages of 18 and 48 has had the vaccine within the last couple of weeks, and they're now watching for the sort of symptoms that the CDC has told people to watch for, leg pain, abdominal pain, shortness of breath, severe headache. And the advice is to go to the doctor for that. If you sort of fit the profile and you've had this vaccine in this period of time and you've got one of these symptoms now, what would the doctor do in that circumstance? If I went to my GP, presumably they would do a check to see if I also have low platelets. Would they contact a specialist immediately because this would be a difficult thing to treat? How alarming is it if I was going to present to this to my local hospital or my local GP if I had one of these concerns?
Well, it's an important question, Rachel. And for the first thing your doctor would do is to evaluate the severity of your symptoms, including doing a neurological exam to see if you had any, what we call neurological deficits that may be associated with the stroke. And after doing that assessment, they would likely quickly, if they were concerned enough, get you to a setting like a hospital where you could have a series of tests done. Those would include blood tests that would look at your platelets, your platelet count, your clotting cells. And they may also involve imaging, like CAT scans or MRIs, depending on where they were concerned a clot may be localized. But what's also important, Rachel, to note here is what kind of symptoms we're worried about. And I'm so glad you brought this up, because many people who receive the vaccine, whether it's the Johnson & Johnson vaccine or other vaccines, will experience some flu-like symptoms for a few days after they get the vaccine. Those might include fatigue, they might have a low-grade fever, or they might feel some chills, or might feel nauseous. They may feel kind of like they have the flu for a day or two. We're not so worried about those symptoms, and they sometimes include a mild headache because those go away within a day or two and they don't have lasting consequences. What we are more concerned about are symptoms that include severe headaches, abdominal pain, swelling in the legs, a shortness of breath, which may indicate a clot has traveled to the lungs. These are more of the circumstances that would alarm, a clinician, and those are reasons why you should call your doctor if you have any of these symptoms and if you've had the J&J vaccine recently.
Now, you mentioned the sorts of reactions that people have frequently had to the vaccines. Last week, we saw a few sites in a few different states stop administering the Johnson & Johnson vaccine temporarily when people had seemingly less scary reactions that you're describing, things like lightheadedness, dizziness. Is those experiences last week, with those temporary pauses in a few different locations that were administering the same vaccine, is that unrelated? Is that totally different? Have those been looked into as to whether or not those might have been something serious as well?
Well, looking at the totality, of the data around Johnson & Johnson, like all of the concerns that may have been raised, whether they are mild or whether they're major, that's all part of the process, Rachel, that's going to take place over the next few days. Tomorrow, the ACIP, which is the committee, advisory committee to the CDC on immunization practices, is going to be meeting and looking at the breadth of data we have available to us. And they're going to help us understand, working closely with the FDA, whether there was in fact a broad, a link between these concerning clots and the actual vaccine administration. But Rachel, I think the really important thing for people to realize here who may have received the J&J vaccine or whose family members or friends may have gotten it is that the vast, vast majority of people, the vast majority of the 6.8 million people who received this vaccine in the United States have done well. And if you've received the vaccine and you're hearing this news and you're wondering, am I going to be okay? The odds are absolutely yes that you will be okay. What we are investigating are rare occurrences, and we're doing it out of an abundance of caution. But we recognize that if we want people to take this vaccine, if we want to turn this COVID pandemic around, we're going to have to do everything possible to make sure people have the right information and that they know beyond a shadow of doubt that we're taking their safety seriously and investigating any and all possible concerns.
I will say, as a person who personally received the Johnson & Johnson vaccine within the last week, who turned 48 at the same time, I felt like, on the one hand, you never want to wake up and see the headline that says, oh, this thing that you just got, turns out there might be an issue. On the other hand, I feel a little bit of a sense of relief knowing that This is a decision that was made at the FDA and the CDC based on the science, because they're being vigilant about it, because it was so rare. Even though it was less than 1 in a million, they're on it. They want to make sure that they're nailing down every potential and any potential danger that they want to make sure that they understand. And so just speaking from a personal perspective, I can tell you that I'm having both of those feelings at once. But what should we expect from that ACIP process? Obviously, the FDA is looking at this. The advisory committee for the CDC is going to be looking at this tomorrow. What do you think we should expect in terms of how long a review this will be, how long a pause this will be if they decide that this is correlative and not caused by the vaccine, and that this is safe to restart? How long a process do you think that would be beginning to end before we know the resolution?
Well, Rachel, I'll tell you the intention here is to do this as quickly as possible. There's a great sense of urgency around making sure this process is expedited and that it happens fast. That's why the Advisory Committee on Immunization Practices is meeting tomorrow. So I would expect that this would happen on the order of days to maybe a few weeks, and as opposed to in the order of months or longer. And I'll just say, look, I'm so glad that you got vaccinated, Rachel. It's one more person who's protected then, against COVID. But I also think it's so important in this moment that we not let today's news make us lose sight of the broader progress that we've made. We have vaccinated so many people in our country, more than 120 million. As a result of that, particularly because we focus on vaccinating older people who are more vulnerable, we have seen deaths among the elderly drop, particularly in nursing homes. This is a preview of what we can do all across America, Rachel, if we focus on vaccinating people, getting them the right information so they can make decisions for themselves and their families. And I know it's tiring because, we've been at this for more than a year. And as people see news of cases ticking up, they just feel exhausted. And gosh, I can tell you, I can relate to that. But we are, seeing the light at the end of the tunnel getting brighter and brighter. We just have to hold on a bit longer, keep wearing our masks, keep washing our hands, keep avoiding indoor gatherings, and get vaccinated as soon as you possibly can. That's the key to ending this pandemic.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.